I'm Jonah Comstock, editor-in-chief of pharmaphorum. I'm here on the sidelines of JP Morgan 2024. I'm joined by Katherine Stueland, the CEO of GeneDx. Hi, Katherine. Thanks for sitting down with me today.
Thank you.
So tell me a little bit, first of all, about GeneDx and about yourself.
Wonderful. So GeneDx was spun out of the NIH more than 20 years ago, and it was really formed by a group of clinicians who were expert in diagnosing the hardest to diagnose patients. And at the time, many of them happened to be children. So they got to a point where there was enough of those patients coming through that they thought that they might be able to start a company to be able to really support diagnosing as many patients as possible using genomic sequencing. So we have emerged over the past 20 years from being a pioneer in the space of bringing whole genome sequencing to many patients. First with multi-gene panels, now exome sequencing, as well as whole genome sequencing.
Wow, that's really interesting. So are you in the direct-to-consumer gene sequencing space, or is it more working with providers, working with healthcare systems?
So we work with providers and with healthcare systems. Many of the patients who we are diagnosing, their parents have been struggling to figure out what has been going on with them. They're missing milestones. They are having unexplainable symptoms. And so we really feel like it is important from a patient perspective to have a partnership with the provider. So that way we can give the information to the provider. We can provide any clinical context. We have an army of clinical geneticists on our team who can help provide some additional insight into the test results. And then that enables the provider to be able to give the diagnosis and then be able to direct their patients to a treatment, to a clinical trial, or to a support group.
So tell me, we've had the genome mapped for a while. What are the innovations that are still happening, that change what you're doing? How are you kind of advancing this science?
It's a really important question. One of the most important elements about what we do is our ability to interpret a genome's worth of information. And to be able to do that at scale is no easy feat. So for every patient that we are running whole genome sequencing on, we are able to deliver a result that has a higher level of confidence and certainty than others who provide a similar service. And that's because we've done over 500,000 clinical exomes. So that underlying data asset that's informing the algorithm and the clinical platform really ensures that for every patient that we run, we're able to actually inform our algorithm, which helps close the gaps related to variants of unknown significance. So we're then upgrading or downgrading variants based on what we're learning along the way. So one, I would say, is our interpretation platform and how we're able to, at scale now, be able to deliver a higher level of certainty of whole genome sequencing to more and more patients. Second, we're also making new gene discoveries in terms of how they correlate to disease. So we're publishing routinely on new discoveries that we're making. We're contributing to ClinVar, which is an important public database, which helps inform other labs as well. And so through the interpretation platform and those discoveries along the way, we're really helping to ensure that the benefits of whole genome sequencing can be delivered to as many patients as possible.
That sort of connects to what I wanted to ask next, which is, a lot of the talk about genetics that I'm hearing at the conference is about gene therapy and the intervention side as opposed to diagnostics. But how does your work inform that? How do those developments inform what you do?
It's an important part of the overall ecosystem. You can't treat it if you can't diagnose it. So I think one of the most important elements of the shift that we are trying to make in medical practice is ensuring that diagnostics becomes the standard of care, and that genomics is really that new standard of care for all patients. So that way, the sooner that a patient is diagnosed, the sooner we can, in fact, connect them with a gene therapy that may be in clinical development or may be FDA approved. We want to work in partnership with biopharma companies and have started doing so effectively and being able to take our data asset and patients that may be eligible for clinical trials or FDA approved therapies. So we work in partnership to say we can reach out to a patient's clinician and connect them with a clinical trial or a company that may have an FDA approved therapy.
So I noticed you talked about data, you talked about algorithms. Mm-hmm. You didn't use the term AI, mm-hmm. Maybe on purpose, I don't know. But talk to me a little bit about the current hype about AI over the last year, and how you use it, how that's changed, if at all, over the last few years.
It's rapidly impacting the way that we're conducting our business, both in terms of how we are scaling our interpretation platform, how we're taking the knowledge base that we have and ensuring that, again, at scale, we're able to deliver that highest confidence level result. But we're also looking to how it applies towards business operations. So an important element of access for patients is being able to make sure that patients have insurance coverage and that we can then actually have a smooth billing process. And so AI can actually help inform the way that we are able to procure medical necessity documents that support a claim that may be going to a payer. So I think there's a whole host of ways that we are today deploying AI and will continue to deploy AI from a clinical perspective, from a scientific perspective, but also just in terms of the nuts and bolts of how we operate the business day to day.
So thank you. That was a great answer. Taking a kind of a bigger picture look at, this is the conference where we kind of try to look ahead and think about what the big trends are going to be that impact pharma in 2024. What's on your mind?
Really, as I think about the broader healthcare ecosystem, I think continuing to bring genomics into the overall healthcare conversation, whether it is about health disparities. We actually have a patient population that is very representative of the US population, which is rare in and of itself in genomics. Most genomics companies have patient populations that traditionally are Caucasian. And so I think being able to be a leader in closing health disparities is something that we as an industry need to continue to keep our eyes on. I also think the ecosystem and the partnership between biopharma companies, between investors, between patient advocates, and between diagnostics companies that are able to enable the connection of getting people out of a diagnostic odyssey and onto a treatment path as soon as possible. That's really what we're aiming to be able to do. The sooner, as I said, the sooner that we can diagnose, the sooner that we can treat. And that ultimately is what I think we as an industry and we as humans are trying to accomplish, is just a healthier state of being for people.
It does sometimes seem like at a system level, there's not nearly as much emphasis and as many resources into diagnosis as there are into therapies and treatments. Mm-hmm. Why do you think that is?
I think that the diagnostics industry, I think it is an underappreciated industry. And yet I think that it is the number one thing when you talk to biopharma companies. They're aiming to find patients as quickly as possible. The sooner they can identify patients, the sooner they can enroll in clinical trials, the sooner that they can actually get to a regulatory pathway. So I think we're a bit of the underdog, but I think we're a necessary part of enabling the visions and missions that so many of these companies have. And I think in some regards, that's okay. I think it's okay for us to be the enabler and kind of the backbone of it. But I think that we have a real passion about making sure that people get diagnosed sooner. Many children with rare diseases don't get diagnosed until 8, 9, 10 years of age.
Yeah.
Some of these conditions are actually, we can identify them at birth. And so really trying to ensure that we can get an earlier diagnosis to prevent progression of disease, to delay progression of disease, to be able to reduce the burden of costs. For many of these families with rare diseases, there's a higher rate for the parents in particular of depression, of divorce. There's a whole host of psychosocial issues that come along with the diagnostic odyssey. So our hope is we're going to continue to drive utilization as early as possible, not only because it's better for patient care, it's better for our overall health economic prognosis and ability to ensure that patients remain healthy people.
Well, thank you so much, Katherine. This has been super interesting. I really appreciated learning about what you do.
Thank you so much.